Unfortunately, up to about 1 in 5 pregnancies will end in a miscarriage or early pregnancy loss. One of the first things that we do when this happens is try to work out why this may have happened. It's still not something that's spoken about very often, and products of conception testing can help us to find answers for these early pregnancy losses. POC, or product of conception testing, is a test that we can do after an early pregnancy loss or miscarriage. In about half of early pregnancy losses, we know that it can happen due to a chromosome problem. In total, there should be 46 chromosomes in a developing embryo or fetus. When there is any extra or missing chromosome material, that can lead to a pregnancy loss. By considering this test, we can find answers about whether this may have contributed to the loss you experienced. Following a miscarriage or early pregnancy loss, your doctor will collect some of the tissue, which is then sent to the genetic testing laboratory. Scientists at the laboratory will assess the tissue very carefully to try and identify either fetal tissue, placental tissue, or chorionic villi. This is important because we don't want to be testing maternal tissue. Once this tissue has been identified, they will then use a technology called next-generation sequencing to screen the chromosomes to determine if there was any extra or missing chromosome material that may have contributed to the pregnancy loss. Anybody that has experienced an early pregnancy loss or miscarriage may want to consider products of conception testing. Because the test can provide answers for why the loss may have happened, it may help your clinician to focus their investigations. For couples that have experienced multiple or recurrent pregnancy losses, it will also assist with determining whether additional genetic testing may be needed. In most cases, chromosome abnormalities are random or sporadic events that occur, and the risk in a future pregnancy would not be significantly increased. One of the risk factors that increases the chance of a chromosome abnormality occurring is female age. As women get a little older, the risks start to increase. However, in a very small number of couples, there could be an underlying chromosome problem that may increase the risk of a future loss in another pregnancy. This is something that could be identified by products of conception testing, but would need to be discussed with a genetic counselor.